So, this is my project, Cultivating Compassionate Care. The background. Quality health care is constantly being evaluated in the public's eye. Compassion plays a pivotal role in the perceptions that health care provides. Society demands that nursing functions and maintains compassion while medical advances cause streamlining of care. There is more emphasis being placed on information technology and less is being placed on compassion. Nursing foundations should be built upon a theoretical framework, sound in research adding to credibility. Less emphasis through the literature is being placed on that compassion from what the reviews speak to. Reflecting on nursing curricula, compassion is briefly touched upon and not specifically taught in a framework to serve as a foundational structure. And there is need for this foundation from what the literature is saying. The problem is there is minimal published research exploring the lived experience of compassion from the student's perspective. Little is written on how caring is articulated into nursing programs. Literature brings out how caring behaviors are necessary to enhance compassion, communication, as well as connection to the patients. The purpose of this study is to achieve a better understanding of the lived experience of compassion for preclinical nursing students who have been exposed to a caring theory-based curriculum. Literature talks about the curriculum or nursing programs being revamped to only include the basics while much is being set aside, such as compassion. Faculty are assuming that students just know about caring behaviors. Nurse educators need to understand this lived experience and create curriculum strategies to cultivate this compassionate care. Strategies can be used to enhance lessons in empathy, assisting the student with a deeper understanding of caring behaviors. Nurse educators need to provide educational activities and opportunities for students. Research question. What is the lived experience of compassion for preclinical nursing students who have been exposed to a caring theory-based curriculum? Van Menen states, feminology helps us understand and uncover this experience so that we can become self-aware of another's experience in that particular time. Madeline Leniger's model. She specifically goes over a couple of points, the essentials in the components of cultural care as well as cultural sensitivity, being able to incorporate a plan of care for that patient. Her Sunrise model talks about how students must acknowledge transcultural differences in patients to learn effective communications, to be able to incorporate their values and beliefs, as well as connect with that individual's ethnicity. This leads to a further cultivation of that compassionate care. Cultural sensitivity. Students must develop an understanding on how individuals' health and behavior may impact the healing process. Traditional methods of healthcare delivery sometimes conflict with patients and because of their cultural beliefs and values. This is a great opportunity for nurse educators to be able to develop this cultural competence in nursing students, to promote sensitivity, and to really promote a theory-based curriculum. Science is used to heal, but cultural care is used to further connect one to that individual. Madeline Leninger's model, again, leads to cultural preservation or upholding one's values, practices, and traditions. Cultural accommodation to adapt to patient outcomes so that a patient might be able to heal quicker. Cultural care restructuring to modify that health care as need be. Literature review. I reviewed 20 articles. 4 themes popped out. Students that experience compassion, studies exploring the impact of culture, studies exploring tools to measure compassion, and educators' experience in compassion. Christensen in 2009 did a study on cultivating authentic concern, exploring how Norwegian students learn this key nursing skill. This was a qualitative study. The study showed students lacked communication and caring behaviors. What the study did promote is that nurse educators need to teach students how to connect and develop with nurse-patient relationships. They also need to learn how to pick up on the subjective data that the individuals are telling them, as well as the patients felt that the students need to be more committed to the situation at hand. They weren't receiving that caring behavior from the student nurse. And also that student nurses needed to be very careful with their body language. They would say one thing, but they were actually saying another. Cultural concern is not only the responsibility of the student, but it's of that nurse educator to be able to teach what the culture is about and how to establish these caring behaviors. The next study was Gabru, Khalif, and Williams back in 2008. They did an outcome analysis of a research-based didactic model for education to promote a culturally competent nursing care in Sweden, and this was based on a questionnaire study. The aim was to find if education accomplishes cultural competence. And they did this study at Malmö University in Sweden. Malmö is the 3rd largest city in Sweden, where 33% of that population are foreigners. They wanted to assess the attitudes and the experiences of nursing students before and after this didactic-based model that was instituted. This model was very important to my study because it was based on Madeline Leninger's theory. So it really gave some emphasis to what I'm trying to say. That first year, they learned this sunrise model, inside and out. That second year, they applied this model. And through application of this model, it was shown that cultural differences could be demonstrated by nursing students. They were more aware of the situation. They were able to integrate a person's practices, values, and beliefs into personal care. The article, therefore, supports nurse educators to enhance this compassionate understanding as well as cultural care in the lived experience of students, providing a caring-based theory model, which was very important. Torvisk and Hedlund in 2008 conducted a qualitative study in Norway looking at cultural encounters and a reflective dialogue about nursing care. They explored the nursing students' development of practice through cultural encounters with Tanzania and Norway students. This article revealed a tremendous need for cultural competence due to the world globalization of patients and individuals. Students must learn how to develop nurse-to-patient relationships as well as individualized care. That's what was brought out in this article, based on traditions and values that the patients had. They also brought out in this article how communications have to be perceived and have to be spoken correctly in order to connect with these patients. The students were having trouble. Nurse educators can teach very fruitful cultural encounters to connect these students with the patient's values and traditions. Culture is very unique, which can affect practice if not understood by that nurse. This supports a need for a caring-based theory curriculum. Overall, the Norway students were able to connect just a little bit more than the Tanzanian students in this particular study. The next article was Krieger in 2001, Antecedents to Engrossment in Nodding's Theory of Care. This was a tool to measure compassion, and there's not many tools out there from my lit reviews. The engrossment is how much students could become involved. How did they understand? Could they act upon what was going on in a person? The first step was really to engross yourself or to involve yourself with that patient or family. And then the second step was to be able to set aside your own concerns and to act upon the needs of the patient or that individual you are caring for. The article revealed how engrossment in Nodding's theory really identified those antecedents of empathy. Caring is a learned process, but also can be taught. And if nurse educators can teach caring-based theory curriculum, this can facilitate an awareness of others, as well as an alignment with some type of nursing theorist, which is very important. Peters in 2006, Compassion, an investigation into the experience of nursing faculty. This was a qualitative, open-ended study looking at Van Men's method to gain insight of the lived experience of nursing faculty with compassion. Chosen were full-time undergraduate nurses in this particular study because they had the essential role of teaching students caring behaviors. Faculty very much understood this phenomena and they were aware of the literature that was out there with theory. However, nurse educators need to develop creative strategies to promote this growth in students so that their practice may be enhanced. Synthesis of evidence. Obstacles for students are that the social sciences and humanities offer little connection from theory to practice. The literature shows a need for cultivating this compassion. Educators can really bring exposure to the literature to understand the lived experience. There's a great need for exposure to a framework that focuses on caring and cultural competence. There are many theorists out there, but really nursing schools do not focus on just one. They cover a multitude of them. And I don't know if you can reflect back on your nursing curricula, but I don't ever remember being taught just one nursing theorist to, study from. Cultural learning practices must be understood to promote compassionate care and holistic healing. It does heighten one's awareness and sensitivity to these caring behaviors, and it can enhance communication skills. Application to nursing process. Understanding the lived experience of preclinical nursing students can inspire future research. Development of a caring-based theory is very much needed. Teaching the essential elements of compassion is also needed, because faculty cannot assume that students just understand how to give caring behaviors. Many students lack that I see at the bedside. Understanding the intricacies of a culture due to the distinct healing processes, students also need to understand the social sciences. They do teach about the different cultures, but they don't really show the students how to make those connections. Research design. I would do a qualitative research method based in feminology, exposure to a foundation, paradigm, and a theory of caring. My participants, I would recruit from a nursing school who would use Madeline Leniger's transcultural care. And I did a little bit of research. I do know the University of Michigan does use her, as well as I believe Nazarene College, from a good source of mine, told me in this room that they also use her. My research approach would be to conduct interviews. And of course, before conducting any interview, I would consult the Keuka IRB. And my overall approach is to really gain an understanding of the student's lived experience and compassion. My plan, again, would be to interview them face-to-face before their first clinical experience after being exposed to this theory, and to uncover those elements of the lived experience. The analysis, to audio record the conversations, capturing the description of the lived experience, to then sort, categorize, analyze, and code them into themes. And it is hoped that I can gain on how this compassion evolved during the curriculum. Some of the interview questions I could ask: tell me about a time when you experienced compassion. What were the surroundings involved with the experience? Where and when did it take place? Who was involved? Were there cultural differences to consider? And if so, how did this affect you extending or receiving this compassion? In summary, a gap in the literature does exist regarding this topic. All my studies were from outside the United States. Educators need to understand the importance of making that cultural connection, and then to create preclinical practices that really build upon the cultural experience and the competence for holistic patient care. And there's my references. Thank you.